ACEs are commonly known as adverse childhood experiences. They are stressful or traumatic events that happen to individuals up to the age of 18. They can range from any form of abuse or neglect or household dysfunction. An example of that would be somebody in the family who's got substance misuse challenges. If adverse childhood experiences aren't dealt with, or if we don't work in a very positive trauma-informed way, they can lead to poor health, educational and life outcomes in later life. Although it talks about childhood, it goes through the whole adult life course unless we do something differently with our residents. So it's important that we put in place a range of protective factors to improve people's well-being. So our vision now is for Manchester to be an ACE-aware, trauma-informed, trauma-responsive city. We're working in many of our neighbourhoods across the city and through a whole range of sectors.
Making Manchester Fairer is our programme and ambition to reduce health inequalities in Manchester. So that means improving health outcomes for all of Manchester's residents and communities. But really importantly, it's about narrowing the gap between the people who have the poorest health in the city and the people who have the best health. And often the people who have the poorest health have that because of their social circumstances, because of poverty, because of poorer access to good education, because of jobs, because of housing, the environment, discrimination. And if we're going to help those people get the best out of life and the best health, we can't do that without having a trauma-responsive approach. I think there are a few main and important focuses. So making sure that services are what we call trauma-informed and trauma-responsive. It's what we call being person-centred, so thinking about what is important to the person who's in front of you, what have they experienced in their life that might be explaining some of the behaviours that might be seen as difficult or challenging, but are that person's subconscious way of dealing with the difficulties they've had in their life that have got them to where they are. So it's really important that the services that we provide and the people who work in those services really take that on board so that we get the best for people in those services.
It doesn't take much more money to do this. It just takes a different focus and to view it through that trauma-informed lens. So I think you'll be able to see the art of the achievable and see what's possible and see what impact it has.
The reason why our trust decided to incorporate trauma-informed practice, we were aware in Manchester that there was already a significant amount of trauma within our community that our families were experiencing. And then we started getting data that there'd been a significant increase in the level of domestic violence in homes within an area which was already higher than national average. And then we looked at the other factors and we knew that families were being impacted by poverty, that parents had worries about employment, and that we needed to do something to address these problems. We decided it was important to work in this way because children feeling happy and secure in school will mean that they're in a place of readiness in terms of their learning. So if our young people and children come into our schools and they're emotionally dysregulated and they're upset, there's been a big event in their lives that they're thinking about, then they're not going to be ready to learn. So we felt it was really important to address these underlying issues as a priority before even beginning to think about their education.
So the first steps was focusing on the senior leaders and the directors kind of knowing what trauma-informed was and having a vision, and then it was incorporating that into whole staff training for starting with senior leaders, governors, directors, to then work into a whole staff approach, working with staff to model and coach of what that would look like in the classrooms as well. So we tackle it by, one of the key things is relationships, so having really positive relationships with everybody. We focus on our routines in school and classroom to make young people feel safe. We also focus on responses, so if a young person is dysregulated and needs additional support, how do we respond as an adult to ensure that they feel safe and to support them with their emotional regulation? With regards to policies, we've completely amended our behaviour policies across the trust. We're also focusing on a relationship policy that kind of informs us on kind of best practice with how to interact with everybody who comes into our school environment. With regards to procedures and practices that we use, we've focused on an enrichment curriculum. Our personal development across the trust has improved, so we're focusing on developing the whole child now.
So in terms of support for the children who've experienced trauma, we have a forest school available at one of our partner schools that we visit wherever we need to. We can refer children to visit on a weekly basis or on a more long-term basis. And we have Arlo, the therapy dog, who comes into school and he's available for children to stroke and spend a bit of time with. And we know that it rapidly decreases children's cortisol levels when they're spending time with the dog. The major benefit for the children is to develop their confidence and resilience and encourage them to believe in themselves and have a go at something, even if it's something new and unexpected.
When I was in year 4, I didn't really like coming to school because I felt sad. There was no one to talk to, but then Selena came in because my nana sadly passed, and then she kind of just helped me through it. So we used to feel like a 6 out of 10 because I had no one to talk to really, but now I feel like a 10 out of 10. And I love coming to school now, and I love doing all the lessons and I don't have to worry about anything because I know all the teachers and all my friends are there for me.
Suspension rates and exclusions rates have dropped significantly. We've also seen an increase in attendance for individual pupils and groups of pupils. And, we end up with communities and environments that feel really calm. We create a culture of calm and positive atmosphere so that young people are ready to learn and they've got trusted adults that they can kind of interact with throughout the day as well.
The journey, like any journey, takes time because it's about changing people's hearts and minds. And for trauma-informed practice to be successful, every single member of staff has to buy into the belief that this is a key priority for the children and young people in their schools.
So with regards to kind of the overall impact, I would really recommend trauma-informed approaches across organisations because what we're seeing is an improvement in staff retention, staff recruitment, we're seeing an overall happier community. And although it takes a little bit of time to kind of get it incorporated across your workplace, we definitely see improvements overall.
Well, the Street Engagement Hub is a multi-agency project with partner agencies that are made up from statutory bodies and charities. The hub was set up initially to tackle begging and antisocial behaviour in the city centre amongst mainly the rough sleeping community. It's a safe space where they can engage with various different services in one place and walk away with a positive outcome and live a healthy and safer life and get off the streets. The people that we deal at the hub are individuals with very complex needs, addiction, mental health issues. They find themselves on the streets, evicted from various accommodations, in and out of prison. They're individuals that are struggling to access services through the normal channels.
Riverside is the largest provider of homeless services in the country, and we got involved with the hub because we're specialists in homelessness. Our role within the hub is to coordinate all the agencies. We've got 15 agencies all in one area that we are at different training levels. So it was getting everybody to the same training levels. And then that's where Manchester Council came in, and they've done 2 training sessions now, so that everybody is on that same level and thinking, why is that person hiding in the corner? Do they not like the big space and that's why they're going over there? And it's making sure that we're not traumatising them again through the service.
To implement the strategies, we wanted everybody to be consistent, from little things like respecting people's privacy, not prejudging them. One of the main things we looked at was for someone not to keep retelling their story. So they'll tell the first person a bit of their own history, then they'll go and see one partner agency, and they shouldn't be expected to retell everything time and time again. And it was just getting that consistent approach where we would make the environment as relaxing and stress-free for the clients. Because we were opening up to people, if they receive bad news, they might get angry and kick off, and we had to try and de-escalate. Through the trauma-informed approach, we realised that they might not have slept that night, they might have had a really bad day, and so we just try and de-escalate and appreciate what they've gone through in the past or just prior to coming to the hub.
The benefits of trauma-informed practice is basically you get to know the client quicker. You actually get to know this is the support you need. And the customer and client will just open up a lot more once you've built that trust, because they realise that you're not going to hurt them.
Being trained up in trauma-informed practice certainly makes people more aware of how another person feels when they've been through a lot of trauma in the past. The way our customers or clients open up to us, tell us a lot more stuff that's going on, and because of that we can help them more than we could do. And because of that, they're not getting involved in crime. They're turning their lives around, they've got a chance, and that's what the hub's all about.
About 5 or 6 years ago, I first learned about adverse childhood experiences and how we could become trauma-informed aware in the practice. And as part of that, I met with Gareth Nixon and we started the journey to try to make West Gorton a trauma-informed practice for all of our team, and also to look at how we could bring that work forward to try to improve the care and health and well-being of our patient population. We formulated a training afternoon for the whole team here at West Gorton so that we could train the whole team on what ACEs were, adverse childhood experiences were, how common they are, and how we could become a trauma-informed team. So what we wanted to do then was to look at our patient population and see what impact we thought adverse childhood experiences and trauma were having on our patient population, and really look at how we could improve the care that we're giving to the people of West Gorton.
And then so it's really important that we let you know what kind of support we have available.
We know there's patients who've suffered from lots of trauma, whether that be in a childhood or through their adult life. And there's long waits for psychological therapy and things across the city, actually. So we looked at how we could maybe get some further psychological support for our patients in-house. So we found Sam, who is our trauma-informed yoga therapist. We now refer patients to Sam and have her working with us 3 days a week. Having the trauma-informed yoga therapy at West Gorton has been the major thing that has helped us have somewhere to direct these patients to who are suffering with the impacts of their previous trauma. And the fact that we can refer children to her, anyone from 5+, means that we can try to reduce the impact of any toxic stress on our current children as well.
Patients find many benefits from the yoga sessions. They gain their own toolkit, basically, for managing emotions, overwhelming emotions, managing difficult feelings. It can help to keep blood pressure at optimum levels. Obviously improves breathing ability, so people with lung difficulties, COPD, find benefits like that. Relaxation so that they can sleep better. And putting things into perspective, that not everything is a here and now danger.
Okay, it's a little bit strange, and you've not done this before.
I think the main thing in primary care is, first of all, for the team to ensure that everybody is trained in being trauma-informed. The patient journey starts from when they pick up the phone to that patient or from when they turn up at reception. So it's not okay for just one GP or for just the GPs to be trained. So I think it has to be across the primary care team. And it's just so important that everybody is aware to look behind why somebody might be seeming distressed or maybe seeming getting cross, and try to see how we can help them there and then. And then I think if you have it as a team-wide approach, and then in the GP consultation and the nurse consultations, they can go into a little bit more detail to start asking those questions of our patients. Because until you ask the questions, I don't think you barely scratch the surface as to what people may have lived through. And I think that it's imperative that GPs move forward with this work, train their teams, use this in their consultations, and have a look at what small changes they could put in place in their practice to really try to help support their populations.
MASH is Manchester Action on Street Health. It's a local charity who provides support to women that are sex working or who might be considering sex working. Everything we do is about improving safety, well-being and health. We do that in a variety of different ways. So through our drop-in centre, our van outreach, and in the evening, our sexual health clinic. MASH works really closely with SUSpace, the Lived Experience Advisory Panel, to ensure that women's voices and experiences are central to everything that MASH does. It's a group of women that are passionate and committed to giving back to MASH and shaping the services that MASH provides. SUSpace is named after Sue Murphy, who was a chair of the board of trustees at MASH for over 20 years. She was an incredibly inspirational advocate for women, and that's why the space is named after Sue. We'd identified a need in Manchester for organisations to be better at working with women that have experienced trauma and women that are sex working. So we worked closely with the Department of Public Health to develop a training offer, share our knowledge and understanding in terms of trauma-informed working, and create those spaces for reflection with other organisations so that they can start taking on a trauma-responsive way of working. In terms of MASH's work, this project really gave us the opportunity to ensure that lived experience was at the centre of the work that MASH does. And I think the impact is really hearing it from women that have lived through it and being able to share those experiences and that insight is, that's what the ACES programme has been able to do for us.
We're today at the Welcome Centre in Cheetham Hill, Manchester 8. Every Thursday we get together and we have a group called Empower 8. We do some trauma activity sessions that involves exercise classes. And then we had some hand massage. It's not just health, it's mental health.
Manchester Local Care Organisation is a partnership between Manchester Foundation Trust and Manchester City Council. We've been in existence now for the last 5 years. We've worked really closely with our voluntary sector partners, and in this neighbourhood, the Way In Society is one of our strong voluntary sector groups. So we have worked with them to develop some of the work around trauma-informed practice with community, and that's why we're here today talking about the work at the Welcome Centre, but also putting it in the wider context of the trauma-informed practice across this neighbourhood. We were really interested when we started off working in this neighbourhood about how we might develop a trauma-informed neighbourhood. And we've tested over the last 5 years a number of different ways of working. We've worked with our voluntary sector to develop some community-led work, like the work that happens at the Way In Society, which was really started with Winning Hearts and Minds, Way In, that health development coordinator from the LCO, and they developed very much a relationship group with residents that's grown and grown over the last couple of years. The work around Empower M8 was also around meeting communities where they are. So it's a real relationship-based model. It's kind of based on kind of empowering community members to identify what they want from their own group. From my perspective, it's part of the trauma-informed practice, but for the people in the group, it's a social group that they come to. They've got friends and they've got relationships, and my language might not resonate with the language that they use to describe what they do in the group. But for me, this is about what trauma-informed practice looks like in communities.
With the Empower M8 group, we ask them what they need and we have consultations with them. And they like that idea because it's their ideas that we take and then we take it from there and we make things a reality.
Our most valuable resource, I think, is that consistent relationship building. So it's about people being there for the long haul. It's not a quick fix, trauma-informed practice. It takes time, it takes understanding, and it takes a commitment from organisations.
My favourite is everything here, but mostly exercise is the best one. Well, this is the place where I feel happy.
It's a safe space. That's very important. So satisfying in the work that we do when we see this week in and week out, the change in people, just to see them so happy, that's the important thing.
Bolifit was set up 10 years ago, and that was due to my own story, going through a very traumatic divorce. I was married to a person who for 16 years had lived in domestic abuse. For my mental health, I needed exercise, so I tried to go to a ladies-only gym. Being a Muslim, I felt uncomfortable there because male PTs would walk in, male cleaners would walk in, and when I'd ask at reception, is a ladies-only gym, they said, well, if they've got appointments with females, the male PTs can walk in. We don't have female cleaners, so male cleaners have to come in. Left me really vulnerable, so I didn't want to go there. If I'm suffering that I'm not finding the right place being a Muslim Asian woman to go and exercise, how must the ladies who don't get out as much as me, who aren't active or confident as me? So I set up Bolifit just for my family and friends who are local, put the boombox on, and we created just a music session where they just moved to their own, joy, whatever they felt, they just did it, and that's all it was. With the way Bolifit works, it gives them a culturally appropriate space where they're female only, no males are coming in. And also we understand our women as well, what their needs are. When Gareth Nixon came onto one of our Pakistani sounding board meetings, he explained that he wanted some feedback as how he can create the Pakistani community to become more trauma informed. And that's when I realised that maybe some of the women at Bolifit, the ones that I'm struggling with, that not improving and not thriving enough, maybe they need that kind of support. When we brought in Dignify Limited and Julia did a training session for our women on trauma awareness, some of our ladies recognised the trauma within them and realised it was generational trauma. Some of the women said, I now understand why my husband behaves like that because I now see trauma in him. Well, now we are more than confident that we can build our women stronger and more resilient than ever before because we've got the whole package. We've got the exercise that gets rid of their trauma, we've got the education that they learn and become more powerful with their health and fitness, and now with the trauma-informed work that we're doing, it's just cemented the whole organisation to create more resilient women.
So I hope people can see that this is a really important thing for anybody who runs an organisation or provides a service or is providing support in any way for residents and communities in Manchester to get involved in. It's going to take all of us to do this in a trauma-informed and responsive way to really make a difference. If you do want to find out more, we have a team in the City Council who are leading the work, so please do get in touch if you want more information.